this is a really critical issue for all academic medicine. And I think that there are a couple of areas of focus. One is on efficiency. So providing the great care that we do using the right amount of resources to provide that care. So not being wasteful in the products that we're using, in the being respectful of staffing, and working with leadership to right size our staffing for our clinics and our inpatient services. The other part of it, though, that I think is really critically important is retaining good people, both staff and faculty. So ensuring that our excellent clinicians are engaged and feel excited to come to work at Vanderbilt. And I see that as a critical role of mine as a department chair, is to ensure that we retain our good faculty. And the last part is really growth. And so working with our C-suite to right size growth expectations, identify growth opportunities, and hire folks to support that growth or become more efficient to support that growth.
And go into more detail. How can a physician in chief promote efficiency, and what areas can you do that?
On the inpatient side, we work very hard to make sure that patients who are doing well leave the hospital when they're able to leave the hospital, so that we can turn the beds over in a reasonable amount of time and provide our excellent care to more patients within the resources that we have here and the beds available to us. So supporting anything that we can to reduce hospital length of stay and also facilitate safe discharge from the hospital is important. On the outpatient side, we have large clinics, and making sure that those clinics are full of patients, that the patients are moving through efficiently, and that they're getting the right care that they need while they're in the clinics. So following things like number of patients seen per session, understanding the staffing ratios to support that is really important.